Once again this morning, we are pleased to be joined by Dr. Jeff Harp from Highland Family Medicine. Doctor, good morning. Good to see you.
Good morning.
So I want to begin by talking about testing once again. This comes up over and over again, and still at this stage of the process, some uncertainty about who should be tested and when. And I know even in your setting, you're getting some of those questions.
That's true. Again, we have to realize that this is constantly changing as the circumstances around the COVID-19 pandemic change. Currently, the recommendation is that we reserve testing for people who are extremely ill because the disease behaves differently than many kinds of pneumonia when it develops into pneumonia, and we can watch those people in different ways if they're positive for the virus. People who are mildly ill, there is no proven treatment currently, so it'd be nice to know if people are positive, but everyone, just as you said, everyone should be considered positive. If they're ill, isolate, quarantine, if they've been exposed to somebody who's ill, and really ride it out, trying to involve as few other people as possible.
Been a lot of talk over the last 24 to 48 hours about hydroxychloroquine and its uses as it relates to COVID-19. For those who do have a positive test, is this something they should be taking?
The quick answer is no. Again, there are no proven therapies. Hydroxychloroquine is being used in hospitals in very special circumstances or very certain circumstances, basically as a trial. There is no proof that it will be helpful, but there is some evidence that it might have some effect. And so in hospitals, it's being used. The governor actually, as you might know, issued I think a gubernatorial edict yesterday that pharmacies could not dispense this medicine, hydroxychloroquine, to people who haven't been on it before. It's only people who are on it chronically who can get it now, as an outpatient. So it's really being reserved for very ill patients in the hospital right now.
You know, we talk about off-label drugs being used for other purposes. There is precedent for this, and you certainly, as a medical professional, can certainly understand people thirsting for options as it relates to this elusive disease, right?
That's right, and I think we all want there to be a simple solution that doesn't impact our lives very much, but really, again, distancing, social distancing is the answer right now. Staying away from other people, doing work from home, and trying to make this thing spread slower than it is spreading in most cities where it's spreading.
Well, we are heeding that warning here at News 8 as we social distance and even as we conduct these interviews as well. Doctor, as always, we appreciate your insight. Be well, and we'll talk to you soon again.
Okay.
If you missed any of our conversation this morning with Dr. Harp, we'll have it up online shortly at rochesterfirst.com.